In Memoriam, Dr. Alfred Reginald Brathwaite, 1931–27. Father of contact investigation, Trinidadian roots, Barbadian spirit, Jamaican legacy. In Jamaica's public health history, there are those rare individuals whose work transcends their time, whose ideas reshape entire systems, and whose compassion leaves an indelible mark on countless lives. Dr. Alfred Reginald Brathwaite was such a man, a towering figure in both stature and legacy, whose revolutionary approach to contact investigation transformed disease control in Jamaica and set a new standard for the Caribbean region. When Dr. Brathwaite began his work with Jamaica's Ministry of Health in 1968, the island faced a silent epidemic. Sexually transmitted infections, particularly syphilis, spread unchecked through communities, aided by stigma, shame, and systemic gaps in healthcare. Traditional approaches were failing. What was needed wasn't just new medicine, but an entirely new way of thinking about public health. Dr. Brathwaite's genius lay in understanding that to truly combat disease, one had to combat isolation first. While others saw case numbers and statistics, he saw people, mothers, fathers, workers, all deserving of dignity and care. His pioneering contact investigation method wasn't merely about tracking infections, but about building trust. Adapting international models to Jamaica's unique cultural context, Dr. Brathwaite developed an approach that respected community norms while effectively breaking chains of transmission. Investigators were trained to visit homes at times when people would be available, to speak in language that resonated, and above all, to listen more than they spoke. Dr. Brathwaite's breakthrough came when he recognized the potential in adapting the U.S. disease intervention specialist model to Jamaica's needs. While the American approach showed promise, he knew it required fundamental rethinking to work in Caribbean communities. With characteristic vision, he hand-picked 4 public health inspectors, not doctors or academics, but frontline workers who understood Jamaican life, and transformed them into the island's first contact investigators. This small but mighty team became the vanguard against syphilis. Where traditional methods had failed, they succeeded by combining rigorous contact tracing with cultural fluency. They knew when to visit homes, how to phrase sensitive questions, and crucially, how to build trust where suspicion had once prevailed. In the classroom, Dr. Brathwaite was legendary. Without reliance on modern technology, armed only with carefully prepared slides and his formidable presence, he captivated generations of students. His lessons blended rigorous science with profound humanity, and yes, the occasional joke that flew over some heads, but always served to make challenging material memorable. But Dr. Brathwaite's vision extended beyond methodology. He understood that for change to endure, it needed institutional support. His advocacy led to the creation of the Jamaica Association of Contact Investigators, a professional home for those doing this vital work. What began as JASDIS would evolve into JASDIS, carrying his principles forward into new challenges and new eras. What began with 4 inspectors is today poised to become an army of hundreds, all trained on what he built, equally precise and compassionate, always rooted in local realities rather than imported assumptions. Even after stepping back from formal roles, Dr. Brathwaite remained a guiding light. His home became an informal classroom, his experience a living textbook. When he passed in September 2017, the outpouring of remembrance spoke not just to professional respect, but to deep personal connections forged across decades. Today, the Brathwaite method lives on every time a contact investigator kneels to speak at eye level with a patient. It's present when health workers adjust their schedules to meet communities when they're available. It echoes in training sessions where new generations learn that epidemiology must always be paired with empathy. The measurable impacts are clear. Diseases that once ravaged communities are now effectively controlled. But perhaps more profound are the intangible victories, the trust built between public health systems and the people they serve, the dignity restored to sensitive healthcare, the professional pride instilled in generations of practitioners. As we face new public health challenges in an interconnected world, the enduring wisdom of Dr. Alfred Brathwaite remains our compass. His understanding that true healing begins with human connection. His insistence that methodology must serve people, not the other way around, his vision of public health as both science and sacred trust. His work continues through every life touched, every disease prevented, every compassionate intervention made in his spirit.